Hello everyone, I'm Dr. ZARTASH of Forensic Medicine Department in AYUB Medical College, and today's lecture is going to be about feigned unsoundness of mind or feigned insanity. We will also discuss certain terms, malingering and somatoform disorder and factitious disorder. So the first term here is malingering. Malingering is the deliberate fabrication or feigning of symptoms. They can be physical symptoms or they can be psychiatric symptoms. But for the most part, this lecture will discuss malingering of psychiatric symptoms. So, this is a deliberate fabrication, which means that whoever pretends to have a disease or whoever pretends to be insane is said to be malingering, or somebody who pretends to have unsoundness of mind. So, for example, if I pretend that I'm insane, then I'm malingering to be insane, or this is a sort of fabrication. Why do people do it? People do it to attain certain gains. These I've listed them here on this slide, but they could be anything from procuring an acquittal, which means being declared not guilty by the court, to be considered unfit for trial, to escape consequence of business transaction, or to escape punishment for gross negligence. Now, what does it mean? Say, for example, somebody gets caught in a case, for anything, for murder or for anything, and now the patient wants to be released. So that if that person pretends to be insane, then he can be sent to other facilities rather than to a jail. So this is malingering. Most criminals do not know that even if they are insane and if they commit a crime, they will still be punished, but not in a jail, not in a proper jail. So they think that they'll be released. That's why they start to pretend to be insane. But how do we differentiate this from other disorders like somatoform disorder or conversion disorder? This I'll discuss in further slides. So this is the other term that you must know. What is factitious disorder? Factitious disorder includes people who consciously create symptoms and willingly undergo tests. So this is not something to do with insanity, but rather physical symptoms. These are the patients. It can include psychiatric symptoms as well, but generally these are the patients who want to gain special attention or who want sympathy. So what they do is they fake symptoms, and they can go to any extent. They can get tests done, they can even get procedures done in hospitals. So according to stats, at least 1% of hospital admissions are said to be due to factitious disorders. These are people who are faking symptoms just to be given special attention, just to get special attention. So, for example, if somebody comes to you and says, I have really bad pain in my right iliac fossa, and you assume that this is appendix, it might be that the patient wants attention and is deliberately faking symptoms. Similarly, this can also apply to psychiatric symptoms. Sometimes people can fake hallucinations. Sometimes people can say that I see this individual or I hear voices, but in actual fact, that patient does not hear any voices or doesn't see anything, and has experiences no hallucinations, but still comes to you with these complaints just to get special attention. For psychiatry cases, this is rare, but it is very common with other physical symptoms like appendix or fever or these kind of symptoms. Next disorder is somatoform disorder. Now, this is a case, somatoform disorder or somatic symptom disorder. This is a case in which people do not know that they're faking symptoms. Basically, they're not faking symptoms, but they experience pain or bodily symptoms which they think are present in their body, but there are no physical explanations for those symptoms. So it's necessary that we differentiate these cases, because sometimes the patient is deliberately faking symptoms, but other times the patient is not aware that his or her symptoms, are not serious things. This is because the patient has an extreme form of anxiety, and to that patient, even minor symptoms appear to be really big symptoms. And for example, a patient comes to you and he says, I have pain in my stomach, or I have pain in my epigastric region. And to him, that pain is really, really severe. But when you perform tests, you find out that there is no explanation for that pain. So it is possible that this patient is suffering from somatoform disorder. It is a psychiatric disorder, but the patient is not aware that his symptoms are not very severe. There are several diseases which include pain syndromes like chronic fatigue syndrome, and these conditions which cannot be explained by lab findings, but the patient experiences these. So these are included in somatoform disorder. This is just a general outline to give you an idea of what is malingering, what is somatoform disorder, and what is factitious disorder. In the first two cases, in malingering and in factitious disorder, the patient knows that he has no symptoms. But in this case, in somatoform disorder, the patient is not aware that his symptoms are not real. In this case, the patient thinks that the symptoms are real while they're not. Now, I've given examples of malingering here. So, for third year, at the level of third year, malingering psychiatric illness is important because this is included in feigning unsoundness of mind. And you can be asked to differentiate between true unsoundness and feigning unsoundness of mind. So, this is just an example of malingering. A 35-year-old man was accused for murdering his sister. Upon trial, the defense pleaded that the defendant's sentence be mitigated as he suffered from serious psychiatric illness. So, basically, in this example, a man actually murdered his sister. And when he was called to court to defend himself, his lawyer basically said that this sentence should be reduced because this man suffers from psychiatric illness. When psychiatrists were asked to evaluate the case, after a thorough interview, it was found that the defendant did not suffer from psychiatric illness and was malingering. So, how do we know that this is not true unsoundness of mind, that this patient is malingering? So there are a few things that we should look for. In this case, the man had a clear motive. And what was the motive? The motive was to inherit the victim's property. So when somebody has a motive, then the chances are that he is faking psychiatric illness. And you will notice that the symptoms start abruptly. They're not gradual. So in this case, after the incident, the patient started showing signs and symptoms of mental illness. Before this incident, he was perfectly fine. His symptoms do not point to a clear psychiatric diagnosis. So in this case, the patient will not show symptoms of schizophrenia, or the patient will not show symptoms of bipolar disorder, but they would be just random symptoms. So this is how we make a guess of how this is not true unsoundness of mind, but the patient is rather malingering psychiatric illness. These points are written in your books, and there's a table that differentiates true unsoundness and feigned insanity, true unsoundness and feigned unsoundness of mind. So this is drawn in Parikh, and I'm sure you can find it in other books as well. But these points are very important, and this can come in your viva as well as in your theory paper. So, as I've mentioned before, in feigned insanity, sudden onset of symptoms will occur. There will be no trigger or no family history. If you look at the patient will have normal facial expressions. And if someone tries to pretend to have abnormal symptoms, he or she changes facial expressions too quickly, which is not true for true unsoundness of mind. In which case, the patient doesn't change facial expressions very quickly. And you will notice that the patient pretends to have insanity only when he is being observed. When he is not being observed, the patient will not show any signs of insanity. Now, in red, I've written that in case of factitious disorder, the patient fakes symptoms and the symptom is only described when no one is around. So, in factitious disorder, since the patients want sympathy, they will say that I have this symptom, but you will not see that symptom in the patient. So, in this case, the patient will have symptoms only when nobody is around. So, for example, the patient might say, I vomited a lot of blood, but you will not see the patient vomiting blood because obviously the illness is not a true illness. So, this is also basically a psychiatric condition where the patient wants sympathy, but doesn't experience symptoms in front of other people. But when in case of malingering, when somebody is pretending to be insane, he will show signs and symptoms only when that person is being observed. Signs and symptoms do not point to a particular diagnosis, so you will not see symptoms typical of any specific diagnosis. The patient will not show signs and symptoms typical of schizophrenia or bipolar disorder or any psychiatric illness basically. And the patient will be irked by repeated examinations. A psychiatric patient doesn't care if he's being examined because he doesn't understand that he's being examined. But in case of fake insanity or when somebody is pretending, they will not like to be examined again and again. And the patient in this case, or the person who's pretending to be insane, gets tired easily on exertion. I've already discussed it in the previous lectures that when somebody is truly insane, that person can exhibit extreme levels of energy where the patient neither sleeps nor eats and can still work for long hours without getting tired. But in case of feigned insanity, the patient gets tired easily on exertion. So I hope everybody is clear about this topic of feigned unsoundness of mind. In case of any questions, you can always send your queries on my email on Teams. So thank you very much.